Hello, family, friends, fans. It's C-Man, and it's been about a week, like I promised. Take me about a week usually to post these things. And I'm here to talk about the third year of medical school. There are various subjects that you kind of have to keep in mind. The most important of which, though, is that third year is the most subjective year you'll run into. The reason this is that you're doing all clinical rotations. What does clinical rotations entail? It usually means that you show up as basically like a low-level resident without the power of a resident, meaning you won't be prescribing and things like that, usually, at least not in the beginning. So when you show up to these clinical requirements, you have a variety of things you have to keep in mind. Number one, your grading is typically dependent on an attending physician who's over the residents and over you. But sometimes your grading is actually more dependent on the residents that are over you because the attending physician says, I don't spend a lot of time with these people, how do I know them? For instance, in my surgical rotation, basically the residents sat us down individually. There were 4 people on my particular surgery team, 4 medical students on my particular surgery team, and they said, you know, this is what you did bad, this is what you did good, blah, blah, blah. So very subjective, sometimes very mood dependent, okay?
I love you all. You did a great job today as medical students.
So if somebody has a habit of yelling and blah 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 as a resident, you might be best to steer clear of that person.
You are the all-time worst medical students I've ever seen!
Success in the third year is basically built on learning to anticipate, in my opinion, learning to anticipate what needs to be done and doing it without overstepping your boundaries. For instance, a lot of people in my surgery rotations didn't realize, and I always did, just doing stuff in the surgery suite. You know, getting stuff out, getting your own gloves and gown, not standing in the background, helping move the patient over to the beds, getting the monitor set up that you need to get set up, making sure the position or the patient's positioned correctly, ensuring that the scans and information regarding the patient that you have, at least in the back of your mind, at least some of the important values or important things, such as the stage of the tumor and things like that. Reading up on your patients is very important, specifically in the surgery areas as well as medicine, were the 2 biggest for me. Those are the 2 longest, and typically you'll find that in most medical schools, those are the 2 longest rotations. Now, what is hardest is very dependent on your medical school. For instance, in our particular medical school, surgery is probably considered one of the hardest.
You will love surgery. But it hurts! It hurts!
That and OBGYN.
Doctor! Help me push my baby out!
Get the baby out!
Hold on. My God, woman. Beautiful twins.
My friends at KU Medical Center said that their family practice was extremely difficult. That was kind of like what their school wants to be known for, so it's very hard. Family practice at ours wasn't too hard. The test was a little bit difficult, but that's about it. And so, anyway, you just have to keep in mind what is going to be hard at your medical school and what you need to focus on. Now, some tips from me regarding specific subjects were that if you do all shelf examinations, I suggest buying USMLE World, for step 2, like right off, basically. That can help you because you'll get questions basically, and you can tailor to the specific subject you're in currently, such as internal medicine, surgery, blah, blah, blah. You can do that, and it will be very beneficial to you. Now, hold on just a second. Just reposition here. Second thing is to keep in mind is to remember that there are specific books out there, but I don't suggest getting many of them. The most successful ones I've seen are Boards and Wards. That was a very successful one, very popular with our class. It's kind of an important thing to keep in mind. And also take advantage of any time that you have in third year that maybe is a little bit easier rotation at your particular med school. Take advantage of that time off and maybe do some research and things like that. I said it in my past video, and I'll probably say it almost every video. The earlier you start researching the subject matter that you're going to go into residency for, the better it looks. I for instance, didn't get into it till late third year. The reason I didn't is because I didn't know I wanted to do ear, nose, and throat until late third year. Because of the way our schedules are set up, I didn't get exposed to ENT until third year. Some people don't get exposed to ENT at all due to their particular setups. So the point is that the earlier you know, the earlier you can get into research, the more specific that research can be regarding the residency thing you're interested in, and that'll be very beneficial to you down the road. Let's see. There are a lot of questions some people have regarding, specific rotations. Like I said, surgery is probably going to be some long hours because you have to get there and you have to round on all the surgical patients before you start your surgeries for that day. That's kind of difficult. Internal medicine was very difficult for me because I hated going round and round and around all day. Like, that's all you do. You round on the patients, you come back, you discuss some crazy stuff about them, like, oh, could they have tuberculosis and miliary tuberculosis? Is that possible, causing the spontaneous bacterial peritonitis that they experience today? Well, probably not. No, but they'll, they shoot the crap all the time. And the point is that it's very, very much, you round on the patients, you write the orders. You go round on more patients, you write the orders. And that's kind of what the medicine basis rotations are. As far as the other things, neurology is pretty straightforward. It's very dependent on the hours. We have a very well-structured neurology at Oklahoma, at OU, but some people don't, and that's just how it goes. Family practice, like we said, already discussed, most will find family practice a little bit easier hours-wise because the family practice hours-wise are a little bit better, and I was allowed to do quite a bit on family practice. Some people aren't, though. Like I said, very dependent. And as I said before, I think requirements are OBGYN, family practice, neurology, surgery, internal medicine, and pediatrics are typically the required courses that you have to go through, and then you have some different requirements depending on your medical school. One of the last suggestions I make to people is that because most medical schools are practicing, you're a medical student, go interview the patient. You're a medical student, go ask the patient questions. What do you want to do for this patient? Most medical schools and clinical rotations kind of emphasize that. So I suggest, personally, to take Step 2 CS very close to third year. I did it in September of fourth year, and I suggest doing, maybe in the summer or whatever, I suggest getting Step 2 CS out of the way. It's a pain in the butt. It's a lot of money.
Making it rain, baby.
And you really don't have to study for it if you kind of have, that mentality that fourth year or third year tends to develop, which is I need to ask patient questions and I need to give a workup. Step 2 CS, you do not, I repeat, do not put any types of treatments on the patient. They say you can, but it doesn't really count. So for instance, if some guy's coming in with, a spontaneous pneumothorax, you're not like, needle decompression immediately and freaking chest tube in place. No, you don't do that. Your job is chest x-ray to confirm pneumothorax, but it could be possibly heart attack stuff, so I also want to get some cardiac enzymes and EKG. Your differential workup, that's your job in Step 2 CS, so always keep that in mind. Don't waste points. Anyway, so that's kind of it. And again, if you guys have any questions regarding third year, fourth year, first year, second year I'll be doing in the future, please write and ask, and I'll be willing to answer some. I saw a hilarious video the other day of what it's like to be a doctor. This guy was very funny, and anyway, it's just unique to see some of the people out there and what they offer on the YouTube community. So anyway, just any questions? Hope to talk to you soon. Peace.